Welcome back to the ACL Academy. This is Dr. Kaan, and today I'm going to talk about a subject that here in the United States, most surgeons will not talk about, and that is going conservative with your ACL recovery, meaning not having surgery and just rehabbing your ACL injury. Before I get into that, if you guys have been watching the videos and found some value, please subscribe to the page, please share with a friend and spread the word. So today I'm going to talk about conservative treatment and your options, right? Most of the time when somebody experiences an ACL surgery, at least here in the States, and they get a diagnosis confirmed ACL tear, majority of the surgeons here will tell them if they want to be an athlete or return to any type of sport or activity, that it's imperative that they get ACL reconstruction. And I'm going to tell you that that is not always the case. And there are many factors that obviously go into this. It may not be for everyone, but these days what I recommend is that everybody goes through a bout of conservative care before opting in for surgery. Now, I understand there are different circumstances. Now, if you are a high school athlete, collegiate athlete, pro athlete, and trying to get back to a season the following year, yes, it may be your best interest to prep the knee for surgery and get it done. However, if you are a weekend warrior, if you're an older athlete, somebody in their mid-20s, or older, really, that are not necessarily in a competitive sport or season, right? What I would suggest to you, or would suggest to everybody, is that they all do about 2 months of rehab, normalize some of the issues that the knee undergoes after an acute injury, like pain, swelling, stiffness, weakness, right? Address those issues in some conservative care. And then at that point, make a decision whether surgery is for you or not. For those that want to get back to some type of active lifestyle, depending on your sport, depending on the volume of sport that you choose to do, there is a good possibility that you may be able to return without necessarily getting an ACL reconstruction. Again, this is not for everybody, and there are many factors that go into this, and I would suggest talking to a provider, an ACL specialist, about your specific case and your specific needs and your specific goals. But having said that, when I do get consultations where I'm speaking to ACLers that just sustained an injury and they really don't want to have surgery, but they've been told they need to, well, these are the conversations that I have. And usually how I go about it is, well, I ask a few factors. Well, yes, I want to know their age, but at the same time, age is just a number to me. So for more so, I just want to know their activity level. How often are they active? And what do they like to do? Are there certain specific sports or activities? Do they like to run? Do they like to climb? Those are things that there are certain sports that may not require as much twisting and turning on the knee or torque on the knee, where I probably would suggest that they don't need an ACL surgery. In some cases, they may say, well, they really like a sport like soccer, and they play 3-4 times a week in an adult women's league. Now, these are things that do require a lot of cutting, pivoting, and change of direction and some stress on the knee. Now, in those cases, it may be a little bit more difficult, but it's still not necessarily out of the realm of possibility. So, again, the recommendation is, well, let's see how you respond to therapy. Now, as you start therapy right after your ACL injury, we're addressing those main things that we talked about, and it's pain and swelling early on, getting range of motion back, and then, of course, getting strong. Now, as you're going through this rehab process, what we're monitoring is the stability in your knee itself, meaning, does your knee give way on you? Does it slide out on you, shift on you during everyday activities such as walking, turning, up and down stairs, getting in and out of a car, right? These are all instances where we may see people be unstable. And there are some cases where no matter what you do from a conservative approach, their response is a lot of instability. And there are some cases where people don't experience any instability through everyday activities. So there's kind of two buckets there. Now, early on, after an injury itself, chances are a lot of people will be unstable. Now, as you're going through that rehab process, right, where we're normalizing the knee, getting pain and swelling down, restoring range of motion, getting you stronger, in those instances, we should start to see you become a little bit more stable, right? The more stronger we can get the muscles around your joint, they're going to support it. Now, that's where we closely ask and monitor, well, are you still having some instability? Are you still having some giving way episodes? Now, at that point, let's say 6 to 8 weeks after you've been doing some good therapy, we ask you that question. You're still experiencing a lot of instability. Well, that's probably where we would say to you, well, we did some good rehab, we got you strong, and the knee's still kind of shifting on you. And if you are looking to get back to specific sports, maybe surgery is a better option. But if you're on the other bucket, which most people are when they do some good rehab and they get their strength numbers up and they don't experience any instability with everyday activities, well, then that's really the question is, well, let's look at what are the sports and activities that you really want to get back to, and can we slowly start to transition you back to that? Can we rehab you towards those specific sports? And a lot of those cases that we've worked with here at the ACL Academy, it's a good possibility. And for us, again, as I said before, there's many factors that go into age, activity level, specific sport, volume of that sport, and how your response to the rehab. But if you are responding well over the first 2 months, then we can start to integrate some more sport-specific rehab. Also challenge that knee to progressively make sure that you can take the responses of twisting, turning, shifting, so challenge you in other ways to see how your response is to that knee, which can have some balance exercises, proprioceptive exercises, different type of change of direction and landing, absorption type exercises. So those are the things that we would start to incorporate once you've are ready for that level and you're choosing to go to that route. And if you respond well, then yes, then we can start to slowly return you back to those specific sports that you want to get back to. But really here today, the point of this is not to necessarily give an in-depth approach of how we would handle conservative care, but really to let you guys know, the ACL or the person who experienced the ACL injury, that there's not just one choice for this. And just because if you don't choose not to get surgery, that doesn't mean you can't have a great active lifestyle or the lifestyle that you had before this injury. So I do think it's important that most cases we do not rush into surgery, that we do some good rehab, at least 2 months of it, and see what our response is. And then from there, speak to a specialist that can help guide us or navigate which direction to go to. So it's very, very important that people understand that there is a choice. So first thing, you experience an injury, yes, I want you to get some consultations from a few different surgeons. But secondly, consult with your ACL rehab specialist, talk to them about your options and what options are on the table, and then from there, make an informed decision. So I hope that helps as a recap. If you guys have some questions, please leave them below. If you liked the video, if you got some value out of it, please subscribe to the channel, share it with a friend. This is Dr. Kaan signing off, and I will see you next time here at the ACL Academy.